Hello, I'm Jim Cleary, a medical oncologist and palliative care physician at the University of Wisconsin School of Medicine and Public Health. I lead the Pain and Policy Studies Group, a program of the UW Carbone Cancer Center and a WHO Collaborating Center for Pain Policy and Palliative Care here in Madison, Wisconsin. I'm really honoured to be able to wish you a successful World Hospice and Palliative Care Day and to talk a little bit about the theme, living and dying in pain. It doesn't have to happen. Much of my professional life has been spent in relieving the pain and suffering of people with life-shortening illnesses. This interest started while I was a medical student from the example of my mother, a hospice nurse who gave the first dose of oral morphine in Adelaide, Australia, after spending time at St. Christopher's Hospice in London. It continued with a medical student elective at Mother Teresa's Home for the Dying in Calcutta, India. Seeing the necessity for compassionate care for the poorest and most vulnerable was life-changing in so many ways. Yet all these years later, and we still have a situation where millions of people around the world are living and dying in pain because they do not have access to basic pain relief medicines such as morphine. At the Pain and Policy Studies Group, we monitor and research the consumption of opioids and share that information globally to show how progress is being made. Champions around the world such as you, WHPCA members, and our International Pain Policy Fellows and many others are working hard to bring about change. It is changing, but changing slowly. 75% of the world's population, yes 5.5 billion people, have no or inadequate access to controlled medicines for the relief of moderate to severe pain. As a result, millions of people, including around 18 million people at the end of life, suffer from treatable pain that could be managed with proper access to the correct medicines. But there's much to celebrate as well. There has been significant progress in recent years in countries such as India, Nigeria and Kenya, where regulatory barriers that prevent access to medicines have been addressed. Efforts to improve the pain management skills of clinicians as well as addressing the fears of prescribing opioids are ongoing. At the global level, there's been great work in increasing the conversation and focus on access to controlled medicines as a vital part of healthcare. World Hospice and Palliative Care Day is an opportunity to celebrate what has been achieved, as well as to raise our voices to demand what is a human right for all of us, a life and death free from unnecessary and avoidable pain. Yes, celebrate and raise our voices. So please register your World Hospice and Palliative Care events, share them and join with me and others around the world to make this happen. On World Hospice and Palliative Care Day, I, along with all our partners, thank you for everything you do and request that you keep up the great work. It is people like you that are making the changes that we see on the ground that will enable people to access the care that they need. Thank you.